signs and symptoms. You're going to ask them, what's going on? Are you nauseous? Are you dizzy? How long has this been going on? What are you feeling? Why did you call me? Allergies. You're going to want to know what kind of allergies they have. Whether they're allergic to latex, adhesive tape, or any kind of medication, so that you don't give them something they're allergic to or cause them their condition to worsen because you've given them some sort of allergy. Medications, you're going to want to know what kind of medications they're on, whether they're on blood thinners, things like that, what kind of, maybe they're insulin dependent diabetic and they're unconscious, and that's a very good thing to know because their blood sugar may be out. Your past medical history, it's a good thing to know that, to know if maybe this is a newer onset of something, or if this is a recurring problem, something that's just gotten aggravated and gotten worse over time, or some sort of flare-up. Their last oral intake. This is a good thing to note, especially in trauma patients if possible, because they may need surgery. And the surgeon's going to want to know when's the last time they ate. Okay, the events leading up to the injury or illness. Excuse me. You don't know what they were doing. So they're having chest pain. Well, what were you doing? Well, I was climbing a mountain, or I was carrying something heavy, or something of that nature. This is all good stuff to know, and this is going to be important during your report to the hospital. Okay, let's see. Your symptoms. This is something good to remember. Your symptoms. Let's use chest pain for example, because it's one of the easiest. Your symptoms. You're going to want to know what time did it start. Your onset. How long has it been going on? Provocation. Kind of like events leading up to it. What were you doing when it started? Is there anything that can make it worse, or is there anything that can make it better? Quality can be pain scale 0 out of 10, or what kind of, that's severity. Quality is more along the lines of, is it a dull pain? Is it a sharp pain? Is it one little touch of pain every 10 minutes? You're going to want to know what kind of pain it is, or what kind of whatever it is. Radiation, does it go anywhere? Does the pain radiate down your arm? Does it radiate into your jaw? Does it move into your back? You're going to want to know, where the pain goes, or if it's just localized to one little spot. The severity, this is the pain scale, or the scale of how bad it is. It's very easy to use a scale of 0 to 10. Time, how long has this been going on? Has it been 2 days? Have you been hurting for 2 days? Have you been sick for 2 days? Or did this just start 5 minutes ago? Okay. Your vital signs. So when you're checking your vital signs, you can start with the blood pressure, which is going to measure the pressure of the blood when your heart is pumping and at rest, which is your systolic and diastolic. And it's good to check, especially if they're complaining of something that's related to their heart, or pressure such as weakness or something like that. It's good to check different blood pressures. Check blood pressures in different sides. Check orthostatic blood pressure. There's a lot of different ways that can turn into a good diagnostic tool, more than just how hard your heart is pumping. Your heart rate, it's how fast it's going. You're going to want to know that, because you can tell, if they're in a lot of pain, the heart rate's going to be up. If they have an extremely high heart rate, there may be some sort of arrhythmia that's causing that, or drugs even. O2 saturation, which is going to check the amount of oxygen being carried in your bloodstream. Anything below 92% is going to be considered hypoxic, and you're going to want to treat that with oxygen. The respiratory rate and quality, okay, are again going back to your breathing. Are they sufficiently able to get that air in and out? Are they breathing so fast that they're not able to retain the oxygen they need, or they're breathing too slow and not getting enough oxygen at all. The quality, are they going in deep enough, or are they shallow, are they irregular? So blood glucose, the amount of sugar in the system. Now, your blood sugar can mess with a lot of things. Okay, if your blood sugar is too low, you're going to see unconscious patients with a blood sugar of 30 or 40. You know, or at a certain point, even before they go unconscious, they're probably going to get disoriented. You know, they may be confused, they may be alert, but they're probably not going to remember where they're at, or what day it is, or what has happened, things like that. I've been on probably a good dozen wrecks or so where people's blood sugars have bottomed out. They're alert when we get there, they're looking around, they don't even know they've wrecked. They don't know where they're at, they don't know what time it is, they don't know what day it is. And, you know, they may ask you the same question over and over because their brain isn't able to function properly because they don't have the sugar that they need to sustain. Okay, your pupils. This is going to be a big sign for a couple of things. You're going to want to check that. And that's going to be done by checking to see if they're equal and or reactive to light. You're going to shine your pin light in their eyes and see if those pupils retract or not, and if they come back up. Now, a couple of things to mention on that is going to be unequal pupils. That's a very good sign of a head trauma. Some people, again, are born with abnormal, they're not symmetrical, so some people are born with pupils that one side's bigger than the other, and that's going to be something important to note and something that you may want to ask the patient. Another thing, pinpoint pupils are a good indicator of a narcotic overdose. Okay, so so you get on scene somebody that's going downhill quickly, somebody unresponsive. You look and they've got these tiny little pinpoint pupils. You might try a little Narcan, you know, something to reverse that narcotic overdose. Your capillary refill, I mentioned that before. That's done by squeezing the tips of the fingers or the tips of the toes and counting the amount of time that it refills the blood back into it. Okay, if you know, if you're the transport unit, you're going to be doing an ongoing assessment, or if you're a first responder or such that is on scene for a longer period of time, you're going to be doing the ongoing assessment. So during your transport or during your wait time for the transport unit, you're going to be constantly reassessing the patient for changes. You're going to be looking to see if your ABCs have changed, or if there's any new bleeding, any new bruises, anything like that developing. You're going to want to recheck those pupils, recheck your vital signs every 15 minutes in a stable patient and every 5 minutes in a critical patient, or it may be even sooner than that if you're running interventions such as giving them a fluid bolus or some kind of cardiac drug. You're going to want to recheck those vital signs to see if your interventions are working. And constantly recheck those procedures and interventions that you've done. You're going to want to know that your IV line that you took 10 minutes to get in because they were a terrible stick, you're going to want to know if that's still patent. You're going to want to know if you're going to be able to give them drugs later on. Okay, and in the case that you do give them some sort of drugs or something, you're going to want to know that that's working. If you give an unconscious patient whose blood sugar is 40 an amp of D50, you're going to want to know if that's bringing their sugar up. You know, a good indicator is going to be their level of consciousness and their orientation, but you're going to want to recheck that and make sure that it's not going to bottom out quickly after you've done it. So, your job's never done until you have turned over your patient to the next person, your transport unit or the receiving facility. So, always, always, always check, and recheck. All right, thank you.